How to avoid tobacco addiction. Nicotine dependence, also called as tobacco dependence. In addition to product caused by the drug nicotine, nicotine dependence means you can't stop using the substance even though it causes you harm. Nicotine produces physical and mood altering effects in your brain that are temporarily pleasing. These effects make you want to use tobacco and leads to dependence. At the same time, stopping tobacco use causes withdrawal symptoms including irritability and anxiety. While it is the nicotine in tobacco that causes nicotine dependence, the toxic effect of tobacco results from the other substances in the tobacco. Smoker have much higher rate of heart disease, stroke, and cancer than non-smoker do. Regardless of how long you are smoking, stop smoking can improve your health. Many effective treatments for nicotine dependence are available to help you manage withdrawal and stop smoking for good. Ask your doctor for help. What are the symptoms? For some people, using any amount of tobacco can quickly lead to nicotine dependence. Signs and symptoms that you may be addicted include: you can't stop smoking, you have made one or more serious but unsuccessful attempt to stop, you experience withdrawal symptoms when you try to stop, your attempt at stopping have caused physical and mood related symptoms such as strong craving, anxiety, irritability, restlessness, difficulty concentration, depressed mood, frustration, anger, increased hunger, insomnia, constipation, or diarrhea. You keep smoking despite health problem, even though you have developed health problem with your lungs or your heart. You haven't been able to stop. You give up social or recreational activities in order to smoke. You may stop going to smoke pre-restaurant or stop socializing with certain family members or friends because you can't smoke in this location or situation. Nicotine is the chemical in the tobacco that keep you smoking. Nicotine is very addictive when delivered by inhaled tobacco smoke in the lungs, which quickly releases nicotine in the blood, allowing you to get into the brain within a second of taking a puff. In the brain, nicotine increases the release of brain chemical called neurotransmitter, which help regulate moods and behavior. Dopamine, one of these neurotransmitter, which is released in the reward center of the brain and causes improved mood and feeling of pleasures. Experiences these effects from nicotine is what make tobacco so addictive. Nicotine dependence involves behavioral as well as physical factors. These behavioral association with smoking may act as triggers, situation or feeling that activate a craving for tobacco even if you have not smoked at same time. Behaviors and cues that you may associate with smoking include certain times of day, such as first thing in the morning with the morning coffee or during break at work, after meal, drinking alcohol, certain places or friend, taking one on a spoon, stressful situation or when you are feeling down, slight or smell of burning cigarette, driving your car. What are the risk factors? Anyone who smokes or uses other form of tobacco is at risk of becoming dependent. Factors that influence who will use tobacco include genetic factor. The likelihood that you will start smoking and keep smoking may be partially inherited. Age. Most people begin smoking during childhood. Depression or other mental illness. Many studies show that association between depression and smoking led the people to start smoking. Substance use. People who abuse alcohol or illegal drug use are more likely to be a smoker. What are the complications? Tobacco smoke contains more than 60 known cancer causing chemicals and thousands of other harmful substances. Smoking harm almost every organ of your body and impair your body immune system. About half of all regular smokers will die of the disease caused by tobacco. Women smokers are now at equal risk to men smokers of dying from lungs cancer, COPD, and cardiovascular disease caused by using tobacco. The negative health effects include lungs cancers and other lung diseases. Smoking causes nearly 9 out of 10 lung cases. In addition to smoking causes other lung diseases such as emphysema and chronic bronchitis. Smoking also makes asthma worse. Other cancer. Smoking is the major cause of cancer, esophagus, larynx, throat, and mouth cancer, and related to cancer of bladders, pancreas, kidney, and cervix, and sometimes leukemia, heart and circulatory system problem. Smoking increases your risk of dying of heart and blood vessel, including heart attack, stroke. Even smoking just one of your four cigarettes daily increases your risk of heart disease. Diabetes. Smoking increases insulin resistance, which can set the stage for the development of type 2 diabetes. If you have diabetes, smoking can speed the progress of complications such as kidney disease and eye problems. Eye problems. Smoking can increase your serious risk of eye problems such as cataract and lost eyesight. Infertility and impotence is also caused by the smoking. Pregnancy and newborn complications. Mother who smoke while pregnant face higher risk of miscarriage, pattern delivery, lower birth weight, and sudden infant death syndrome in the newborn babies. What are the prevention? The best way to prevent the tobacco dependence is not to smoke in the first place. The best way to prevent your children from smoking is not to smoke yourself. Research show that children whose parents do not smoke or who successfully quit smoking are much less likely to take up smoking. Here are the steps you can take to prevent future generation from addiction and many diseases associated with the smoking. Talk to your children about smoking. Tell them about danger of tobacco. Encourage them to value good health. You can be a great influencer on whether your children smoke despite what they are what which kind of movies they see and stay in touch with your teens. Studies show that smoking is most likely to become a habit during the teen years. Prompt smoke free movement environment. Ban smoking in your home. Support legislation to make all workplaces smoke free.